Hi, it's Debbie, dentalpracticesolutions.com, and I'm here with Lydia. She's one of the dental assistants at the office of Labiner Oral Surgery in the Bronx, New York. Lydia, I wanted to ask you, can you explain what was it like before we came to your office? Can you explain, was it stressful, was it chaotic, or did you think everything was just fine until we arrived?
Well, since we see a lot of patients, it's kind of stressful. But now that these 3 days that you've been guiding us,
Yes.
and I think like now it's gonna be more communication between the girls in the front desk and the back. We always try, but this we see now that you guys help us a lot. We seen that like you help us and guide us the way, nicely.
So,
And you really, I'm sorry, and you really see like you care for what you're doing, like to try to.
thank you.
Yeah, I love the way you've been teaching us and guiding all these 3 days.
So, did you find that helpful that Susan, she really got in the trenches, Can you talk about that experience of Susan working with you? Number one, for the oral surgery, she created a triage. Can you first of all explain how did that triage system help you to enhance or improve the treatment of your patients and decrease the wait time? How is that helping the doctors to treat the patients with a higher level of treatment?
Yes, in a way, yes, helps a lot because they waiting outside. They're not next. They have a big legs, right?
Yes.
So they've been waiting, and sometimes they have sort of disease that they can wait.
But are you talking about like maybe they have high blood pressure or something?
Or diabetes,
Okay.
yes. And so they need to treat immediately. And also in that way with the triage, they can explain to us how they feel, how painful is the tooth,
Yes.
and how they feel, so we can approach the doctor in the back and let them know the blood pressure or how the situation of the sugar, right? The blood sugar,
Yep,
how
yes.
so they can assist immediately in the
So,
back.
if I understand
Don't have to
correctly,
wait that long.
great. So what you're saying is that we created a triage system for your oral surgery office, and now you're in charge of that. You're actually talking with the patients, you're checking their blood pressure, maybe you're taking some x-rays, and you're going immediately to the doctor to let the doctor know what is happening. Maybe they have a diabetic condition or they need to be seen right away so that their insulin, their sugar levels don't go skyrocketing or go away, they go
Yes,
down.
exactly.
So now we can see them quickly and get them out a lot quicker.
Yes.
That's the improvement
Yes.
right there. And how about between the front office and the back office? Have we helped you with that, Susan and I?
With the communication, yes.
Yeah?
Yes.
Okay.
It's been helpful these 3 days.
Yeah. So, do you feel like there's an improved communication because systems? Did we set up systems, and then we role played with that?
Yes.
Okay. So, do you feel like this is something that when we leave, will you be able to continue implementing
Yes.
these systems?
I seen that. Yes, I seen it. That we can do that.
Okay. Well, Lydia, thank you so much for your time, and I'm really happy to meet you. It's been a pleasure. You're so positive, and it's really nice to work with you. So, thank you.
You too. It's been a lovely